Hey everyone, my name is Sienna Boyd. Welcome back to the Choose Health Studio. Today we are joined with Natalie Nedeau, who is one of our new APPs who's currently practicing out of our Sky Canyon location. We're super excited to have her. And today we're just gonna get to know her. So first things first, how did you start to enjoy medicine? What made you want to practice?
Sure. So actually, my interest in medicine started during my childhood. My grandmother battled breast cancer for 30 years of her life. And it was actually the nurses who had the greatest impact on me. Their compassion and their humor actually helped ease my family's anxiety and fears. So I knew that I wanted to provide the same care to help ease other people's adversities and fears and anxieties.
Yeah, that's wonderful. I know sometimes you can go into that setting so stressful and just get a nurse that'll change your life and make it so wonderful. So what made you want to become a nurse practitioner specifically?
Sure, so it's actually influenced by my experiences working as a registered nurse in the ICU setting. So I loved my experiences being a bedside nurse, and I felt that my critical care experience was very valuable. However, I often found myself frustrated by witnessing the devastating consequences that poor lifestyle habits have for individuals. And so that actually kind of fueled my passion to become a provider, to be a better educator and mentor for patients when it comes to preventative medicine.
Preventative medicine. So you mentioned poor lifestyle choices. What were some of the poor lifestyle choices that you saw coming up with your patients?
So I worked in the cardiac ICU, so you can imagine a lot with lack of physical activity, no stress management, poor nutrition. And so sometimes I would actually see the same patient come in for a second or third heart attack. So that became really frustrating. It's like there's more that I can do for patients.
So your passion not only is within medicine, but also educational medicine for your patients. That's awesome.
Absolutely.
So where did you choose to continue your medical education?
Sure. So I started my education obtaining my Bachelor's of Science in Nursing from Northern Michigan University in Marquette, Michigan.
Oh, nice. Are you originally from Michigan?
I am.
Okay.
Yes. And then I spent 4 years as a RN in the acute medical rehabilitation and ICU setting.
Okay.
And then I pursued my further education from Georgetown University in Washington, D.C.
Wow. Did you like DC?
I did, yes. I'm glad I don't live there anymore.
Cold, very cold,
yes,
very rainy and wet, yes.
But I actually am really excited. I just recently picked up a faculty position with Georgetown, so I'm actually teaching part of their clinical sector. And really excited. I get to do that remotely, so that's really fantastic.
That is wonderful. So you get to see patients in clinic, you get to see people at the Sky Canyon location, and then also get to teach, which is a huge passion of yours, which is so cool. I love that.
Yeah.
And so what brought you to practice here in the Temecula Valley?
Sure. So we actually moved to the area, Southern California, due to my husband's career. And we chose to live in Temecula because we just loved the vibe that Temecula has. My husband and I are both from the Upper Peninsula of Michigan. We came from small towns. And what we really loved is that Temecula kind of still has that small town value that we admire. And also it's just very family oriented. And there's a strong community presence that I'm really passionate about diving into.
Yeah, well, welcome to the area. We're so happy to have you. What kind of things do you like to do outside of the clinic, outside of the exam room, just for fun?
Sure. So one of the main things that I enjoy doing is yoga. And I actually have my 200-hour yoga teacher certification that I obtained a year ago. And I actually, this summer, I was planning on furthering my certification and getting my advanced training in Bali, but with the pandemic going on, unfortunately, that didn't work out. But
how disappointing!
I know it was so perfect, but hey, that's life. Yes, it's resiliency, learning about resiliency. But I'm excited. Hopefully, we'll start teaching this upcoming year.
Okay, that's wonderful. Maybe you can teach a couple classes
that would be
for
great.
Choose Health.
Yeah.
That would be awesome. So you seem like a Renaissance woman. You love to teach, you love yoga. That is awesome. Can you tell us your philosophy of care with your patients? What is kind of the place that you go to when practicing medicine?
Sure. So my philosophy of care encompasses finding the root cause of disease, as well as providing a holistic approach to care. And that's one of the reasons why I went into nursing. That kind of is the nursing philosophy of practicing with the mind, body, and spirit. And I actually am in the process of completing my integrative medicine fellowship from Dr. Weil's program out of the University of Arizona.
Okay.
And hope to start incorporating integrative modalities into my plan of care. That would include things like yoga, meditation, a strong emphasis on nutrition, physical activity, and then even incorporating maybe some evidence-based herbal supplements and vitamins.
Wow, like I said, Renaissance woman. That's pretty cool. I can't wait until you get that and start practicing that. I think that's wonderful. I know one of our other doctors, Dr. Ching, always says the less medication you're on, the better.
Absolutely.
And so that's his philosophy. And so it sounds like it's similar to yours, that you just want to treat causes at the root, try to get people to live a better lifestyle at the root of it all. That's what health is anyways.
Yes, absolutely.
Well, thank you so much, Natalie, for being with us. If you are looking for a new provider, you are more than welcome to see Natalie at our Sky Canyon location. You can give us a call and we'll be able to connect you with her. Again, thank you so much for being here today.
Thank you.